What makes our program here at Hershey unique is our dedication to resident wellness and support and the diverse opportunities that our residents receive. Each of our residents are able to move through our program and custom tailor their experience to their individual needs. Our program is based on a culture of mentorship and support. We have faculty advisors, faculty mentors, and really are able to provide career guidance and development for our residents while they're here.
Right when you walk through the front doors as a first-year resident, you're an educator. Whether that's on the inpatient services, the outpatient clinic, you're working with medical students, PA students, nurse practitioner students, pharmacy students. You're really exposed to a wide array of learners. And as a learner yourself, as a resident, you're mentored through the process with faculty members.
With residency here at Penn State Hershey, we have 6 family medicine obstetric providers that are there to help with teaching. The outpatient care that we give, or what we follow, is prenatal patients. The patients that we get to follow outpatient for prenatal care, we have the same standards as OB, so we don't have to refer for OB care for complex patients. We can keep those. The standards that we have here, whatever has to go to high-risk OB from OB providers here, is the same for us. So you do get to follow complicated patients.
With our osteopathic recognition, both our allopathic colleagues, so the MDs in our program, as well as the DOs, actually get further education in osteopathic medicine and osteopathic manipulative medicine especially, which for me has been really cool because I get clinic days where I get to do osteopathic manipulation on some of my patients.
This last year, we've addressed diversity, equity, and inclusion in a number of ways. We created our Diversity, Equity, and Inclusion Task Force, where we empowered our residents to create projects that would make meaningful change here for our program. Our residents also learn about diversity, equity, and inclusion during our Wednesday afternoon didactics. During our 3 years, we have sessions dedicated to health equity and diversity. So our community projects are resident-led, where they work with the community and form partnerships to make meaningful change here locally. Residents have worked with local LGBTQ health agencies, with local homeless shelters and food pantries, have also formed partnerships with local at-risk youth.
So with the community projects here in our residency, we're challenged to identify the various social determinants of health that our patient population face. So it's not only learning about how to take care of patient populations, but seeing that firsthand. One particular example is working with an underserved clinic in downtown Harrisburg that I'm a part of, where through the COVID pandemic we've had the opportunity to provide food boxes for these families. And not only to provide that physical need, but also to provide education on nutrition and healthy lifestyle as well.
So Beacon Clinic is a free clinic. That's a faith-based clinic that's run in Harrisburg, Pennsylvania. The clinic serves an underserved, uninsured population. The patients that are cared for there represent patients that speak over 27 different languages. So for me, taking care of patients there, when I do and I'm able to volunteer my time, feels like global health in my backyard.
Resident wellness is a huge part of what we want to incentivize and push people to focus on at Penn State Hershey, especially in our family and community medicine residency.
So we have hardwired in kind of 2.5 retreats every year. So usually in the fall, residents and residency faculty will be taken away from clinical duties for a full day, and usually we go off-site and do some team building and play.
I would say it's been a really positive experience that I've had here so far. The people are one of the things that brought me to Penn State, and the people are one of the things that I think are strongest about our program.
We have a large academic center, but we're kind of not in a big urban area, so we kind of get the best of both worlds in that there's a city nearby, you're not far from major cities, but you also have a nice commute to work, affordable rent, and you're getting all those subspecialties here.
Faculty are, they are very in tune with what our goals are. I think at the beginning of residency, they asked us what our interests are, what are our goals out of this residency program.
So our scholarly activity here is something that I never anticipated being involved in. I came from a smaller medical school based with a community hospital where there wasn't a ton of research, but I knew it was something that was important to me.
We have one of the largest primary care sports medicine faculty in the United States right now. All of them are incorporated in resident learning, either during the residency in the family medicine clinics or As residents, you do 2 months of sports medicine, and during those times you're immersed within a sports medicine setting.
Family Medicine Residency Program came up with its new InPatient Unit, a great new facility, a great new thing that has happened, and uniquely enough, within the hospital, we are the only service that has a contained unit.
Another thing that's beautiful, aside from our unit, is the transition of care that happens, because not only are often these patients of ours that we know from the outpatient side, they either are seen in our clinic or a lot of them are our own patients, but we communicate directly with the primary care physician. They're our colleagues, they're our friends.
One thing I was really looking for when I was interviewing for different residencies was a place where I could get all types of experiences, and I think that's what you really get here. We're at a big academic center, but we have aspects of a community program as well, and I think that was really important to me, because if you want to get the experiences of seeing the really rare things, you have to go to a place that has that volume to give you those things.